Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. And today we have Dr. Williams and Dr. Huyer here today, so I'll turn it over to them for some brief remarks.
Thank you and good afternoon. Today being Thursday, we're looking back at what's happened during the week. Today we're reporting an increase of 841 new cases. That is our second highest in this second wave that we've seen in one day. And we have, unfortunately, another 9 deaths, same as we had yesterday. And so that's also concerning as we watch and see how this second wave is working its way through us in the province of Ontario. Most of the cases, as in the past, are reported in our 4 major health units that are in our modified stage 2. Toronto with 335 cases, Peel with 162, York region with 106, and Ottawa with 72. And yet we're seeing increases in some cases in outer ones as well, but still many of the health units have fewer than 5 cases in their jurisdictions, especially those in the north. The age distribution is very similar to what we've seen in the past, with 52.4% being in the under 40 age group, but there is some, as we call, creeping of cases and increasing in the older age groups, such that now we've seen in some recently in the last week, the over 80 group is surpassing the 50 to 60 to 70 group in that one, as well as the under 20s. So we have to see the spillage into those other age groups that we've seen before, and that shows you that the numbers and the contacts within clusters and community groups and outbreaks is occurring and exposing these people either directly or through people visiting or coming into long-term care facilities. And maybe Dr. Huyer will have a comment after I finish my comments in that regard. The testing, we did 38,860. As usual, Thursday is a big day for numbers and that, and we're seeing that again today. 2.5% positivity with that, so that is staying up as well. And we continue to see clusters and outbreaks, some trends and directions. Again, 144 new cases reported yesterday in clusters and school-related cases, 74 today. And the cases continue mostly, primarily it's showing up with students who are coming into the school with it. Not a lot of evidence of in-school transmission, and still with only 4 or 5 schools, 5 closures today of schools. And so that's still, if you think of all the schools that are in the province, still a remarkably low number, regardless of the number of students showing up with positivity and some teachers and staff as well. So that means there's a lot of good work being done, a lot of monitoring and testing and checking being done in the school settings. We're still seeing a lot related to social gatherings, and while we look at the timing of things, is that we're about that 7 to 10 day period out of when we put in our modified stage 2 in the 4 health units I mentioned before. It was also at the same time as there's 7-10 days out, not quite 10 from the Thanksgiving weekend. And so what is the impact, and how well did people refrain from gatherings beyond the household as we asked them to do? But we're seeing some clustering around weddings that probably were going back to that weekend, as well as some exposures in sports settings, and a lot of household and neighborhood clusters as well, which we've seen a number of health units reporting many clusters of more than 10 people in various neighborhoods and groupings in that. The long-term care outbreaks are increasing, but many of those, and Dr. Huyer will comment on those, are related to 1 or 2 cases of people coming in. And again, they seem to be, well, there are some that are concerning, and they're moving quickly with the long-term care and with our IMS group to contain those ones and to do a good job on that one as well. Health units, with our backlog and the turnaround time improving, are continuing to drive back on the case contact management, trying to improve on that, and we're giving them assistance in many ways, either directly with some more resources or indirectly with some assistance from other health units, and we're trying to push that out at this time. So again, our public health measures are consistent throughout. If everyone is doing as they should do with wearing a mask when you're out in public places, when you cannot ensure your distancing of this 6 feet or 2 meters in indoor spaces, which is required, and to wear a mask in those settings because you can't be assured you can guarantee that. As well as we have the wearing, if you're ill, to stay home, of course. And if you need to be tested, you have signs or symptoms, or you have been asked by public health agencies to be tested because of your contact with a case or known case, you need to do that using your COVID app to be alerted if you've been exposed. And of course, there's the hand washing and the use of alcohol or hand rub if you cannot wash your hands. And again, hand washing is the most important aspect. So my overall comment is that we're seeing these numbers. We are still below what the modelers were saying that we might be at this time, who predicted we'd be well over 1,000 to almost 1,200 cases a day at this time. And so that's, well, we can take some solace in that. We have not driven down the numbers well below our level where we peaked about a week or so ago. Again, as we said, today's number is our second highest compared to the one we had over 900 back about a week and a half ago. So we have a lot of steadfast work to do as we move ahead, and everybody to do their part as they move into the late fall season, and to be cautious and careful and follow all those public health measures. So those are my comments. I'm going to hand things over to Dr. Huyer if he has any comments on clusters and outbreaks before we go to the media for questions.
Thank you, Dr. Williams. Good afternoon, everybody. We, on a daily basis, look at the number of outbreaks that are reported through the public health units provincially. And when we're looking at the outbreaks, we're specifically talking about a setting generally, so a long-term care home, a workplace, a retirement home, those types of settings where an infection may have been transferred or transmission occurred between one person and another person within that setting. In long-term care homes, given the increased care and scrutiny and importance, we do define an outbreak as one case. And so a number of the cases are recognized as having staff members only and isolated to a small number, which is a good thing, but still incredibly important given the potential risk that can occur when an infection enters into a long-term care home resident and is passed from resident to resident, given their vulnerabilities from their overall health condition. So we are seeing 20 new ones again today, which is similar to what we've seen through much of the week. Those are all new and additional findings and new additional places where infections have been found and potentially spread within that setting. Over 7 days, we did see 123, so not every day is 20, but certainly that has been most recent. Again, over the 14 days prior, including today, 220 cases. And if we look at the proportionality, again, about 45 to 50% are in the vulnerable sector, so clearly of importance. And as Dr. Williams has talked about, it's not just in the, that's a terrible way to say it, it's in the settings of that are in the modified stage 2 right now, but also we see continued increase in the number of outbreaks, but also the number of neighborhood clusters, as Dr. Williams talked about earlier, increasing number of neighborhoods, increasing number of clusters within those neighborhoods. So moving beyond those in modified stage 2. Having said that, as Dr. Williams referred to, the schools continue to have a number of cases, but the number of outbreaks is comparable to the number of schools that don't have cases, where the Ministry of Education will indicate that 90% of schools do not have cases. So that's a very good hopefully continued trend that we've seen of people being very cautious and very aware and very careful and following appropriate steps to minimize any transmission if there are cases that enter into the school. I think it's important to recognize that we continue to see that number carrying on, and reflects again what Dr. Williams has talked about earlier about people getting together in situations where they may not have their masks and in close proximity for a period of time. And sometimes within a relaxed setting, there is a greater chance that transmission will occur. And always, as we've talked before, to think about everybody's role and how can we work all together to take the steps to do the best to stop this. And sometimes I equate it to a rowing situation where everybody's in, people have seen in the Olympics or participated, where you're in a boat with 8 other rowers and somebody calling when to take a stroke, and each individual person plays a role, but it's all of those paddles rowing together to be able to ensure that they get the fastest and the best possible outcome. So sometimes I think about how to approach minimizing transmission, minimizing the problem that we have, and thinking about everybody's potential contribution to that. I'm going to stop for that, and we'll open up for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Haley Cooper with News Talk 1010. Please go ahead.
Thank you very much.
Hi, Haley.
Dr. Williams, we wanted to talk with you about dining bubbles and these dining bubbles that restaurant owners are thinking about putting on their patios to extend the season through the fall and winter. I spoke with one restaurant owner this week, and he's a little hesitant to purchase a bunch of these bubbles because they're very expensive and there hasn't really been any directive given by public health. He considers that perhaps maybe they could be viewed as bringing indoor dining outdoors. So is public health advising that these bubbles are safe and that restaurant owners can have confidence in buying them?
So these various structures, and there's a wide variety, have been conceptually put forward. I know the Premier has asked us to take a look at those from our public health measures table. We haven't yet sat down to put any details on there. One of the challenges is that there are a wide variety of structures and different things that people do, and I think the owner has a good point. If you make them in certain style, it's like having an indoor place outdoor. In fact, it could be more confining and less airflow than you have inside the restaurant. So we have to make sure that the proper aerodynamic exchange is still maintained to have the concept, if you may, of an outdoor setting where there's enough airflow to minimize the transmission of viruses, including the accumulation of them up on indoor surfaces, etc. In that, because sometimes some of those structures, and have been in the north and seen a few, where people put other types of heaters inside, they're not only not good for COVID, but you have to watch out for proper carbon monoxide and other things with air exchange inside. So there's more than just COVID as far as a safety factor. And again, we have to see what those designs are and what they might consist of. But we haven't put out any standards per se on that at this time. So we'll have to wait to hear from some direction if that's going to be an approved type format. And if so, what design ramifications are necessary to qualify for such entities.
Follow-up?
Thank you. And when do you expect to get that direction? And is there currently an outdoor structure that public health is in favor of that they could turn restaurant owners to? Because it's getting quite chilly out and time is of the essence.
The answer to both those, no, they haven't actually addressed it in particular. They're working on some other priority areas that the government's asked to look at. And as well, we haven't received a lot of documentation materials around the structures and formats, et cetera, in that. It may be a thing that may be under the auspices more of a local bylaw officer in areas of municipalities that might want to use those, simply because there's a lot of rules and things around location, how much space you've got, how they're spaced out. There's things that we can give some direction, but it would be much more probably specified under local municipal structures and settings, because they're the ones that license the restaurants and would have some say on the matter, including the local medical officer of health.
Next question.
Your next question comes from Randy Ross with CHCH-TV. Please go ahead.
Hi, doctors. I'm wondering, we're seeing daily case numbers comparable to in the spring, but we're seeing nowhere near the number of hospitalizations. Do you have an explanation for why that is?
So I'll give a couple of comments that probably Dr. Huyer would want to add some more comments in that. In the spring, when we were having our numbers escalating fairly rapidly, we were dealing with certainly cases in the older age category, a lot of people with comorbidity coming into the hospital and settings. It was new for our hospitals. We didn't know what we're going to be seeing, how we're going to be handling it. And I've had the privilege not so long ago of having a review by intensivists who have updated a lot of things on what they learned and how they're dealing with it. And so all sectors have learned a lot more than they did in the first wave to say, what can you try? Can you use this method or that method? So the science continues to move through, not only in the detection and management and testing, but also in the management in the cases both were in the emergency department and the outpatient basis in the hospital in the intensive care unit. And so it's still early. And I think Dr. Huyer will probably have a comment of how you see hospital cases and intensive care cases related to case numbers in the general population and what we could or might see. So I'm going to let Dr. Huyer make a few comments about that as he sees as far as it relates to outbreaks.
Thanks very much, Dr. Williamson. Hi, Randy. Thanks for the question. So I think it's really important that we talk about a number today, but that number represents a number of days past. So the infections occur, transmission occurs, people get symptoms, they get tested, those test results are returned, and that's representative of when did that infection actually happen and the transmission occur, which is a number of days prior. So our data is always a number of days after the event occurred. Similarly, people who get symptoms will get either not too sick or they may get more significantly ill, and that will take them to the hospital, and that takes a number of days. And then entering into the intensive care unit also may take a number of days down the pathway of their illness. So we are seeing hospitalization numbers go up. We are seeing intensive care unit patients occurring, and we are seeing outbreaks within hospitals where those infections occur. So it's not just one number, and we're also seeing that at the same time that other people are attending the hospital for surgery, for injuries. We now are having car crashes at times and other injuries that are occurring because people are more out and about. So it is a number that is something that we're trying to be aware and think about and follow the immediate moment and be prepared for what's occurring over time. So we are seeing an increase in numbers, a progressive one, and the outbreaks are also concerning because that impacts the hospital generally, because that may take an area of the hospital out of activity, and also the staff may get infected. So there's a number of ramifications, but in fact we are seeing an increase in numbers.
Follow up?
Also, Minister Elliott this morning said that the numbers show that she's fairly confident that Halton will not have to be moved into a modified stage 2. Can we extrapolate that and say that Hamilton and Niagara are also looking like they will not have to be moved into a modified stage 2?
So we're looking, the public health measures table is monitoring the different health units to see a variety of different indicators. You want to see a sustained increase in there. What should you be doing to move someone into the hot zones, if you may, the modified stage 2? And that's being reviewed and looked at as they assess the updated numbers. And as Dr. Huyer's alluded to, we're looking at a few days past. There's always a time delay. And then you want to make sure if they are up in a sustained level, is it been for more than 1 week? Because you have some places where they had a large outbreak, such as we saw in the Spinco type thing in Hamilton, and they went up to a high number, but then they're back down again the next week. So we want to make sure that there's those numbers. We got to make sure positivity rates. We look at other aspects in there that give an indication that the community-wide transmission has increased to such a level that we need to bring in the modified 2 in that. So if there are some directions, we'll give to that up above and advice to the minister. And as we said, we hadn't given that advice yet today, and we'll do it in a timely fashion if and when it's necessary. And so that then can be taken on up to the Premier and to the Cabinet for decision and discussion.
Andy, I think you've illustrated one of the key components at the start, which is the health system capacity. There's 2 others that Dr. Williams has also talked about. I'm reiterating some of the things that he said. So there's number 1, the spread, which Dr. Williams was talking about, the percent positivity, the trend over time, outbreaks that may be there. There are other factors as well, number of cases per 100,000. Then there's the public health unit capacity to be able to respond, to do the contact tracing, the case management, and the response to the particular number of cases. And then there's the health system capacity. So each of those has a number of factors, and all of those factors together, and there's no A is the one, B is the second. It's all variably applied within the not variably in a vague way, but in a number of different ways that are relative to that particular setting and that particular unit as how things get looked at.
Next question.
This question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hello, doctors. Just wanted to drill a little bit deeper into the numbers. We're 12 days out from when the modified stage 2 was imposed in Toronto Peel and Ottawa. And, we did, like Dr. Williams mentioned, we did see the numbers go up to the second highest since that Thanksgiving Friday today. Do you have any way to tell if this is just a one-day blip or we're moving out of that 700-ish range that we have been in for most of the last days?
So, as I said, Rob, we're 10 to 12 days out from when we put in the modified 2, not for York Region, that's a week behind. And but we're also slightly less, 7 to 10 days out from the end of the Thanksgiving weekend. So we're trying to look at the two factors moving maybe in opposite directions. We've seen some improvement in Ottawa's numbers, not the same with Toronto or Peel. So we're still waiting to see the impacts on that. I think the fact that we're going between the low 700s to above 700 to 800, it seems to be where we're at this sort of level at the moment. The amount of testing, the positivity demonstrates there's a fair amount of community activity, and you've seen that from some sub-reports like Dr. Davila noted in Toronto. There's some specific areas that even higher positivity among the people in those areas, sometimes lower testing. We're trying to do all sorts of methods to assist them as they ascertain and deal with that issue. So I'd like to think we could be back down soon. I think as we experienced in the first wave, when we got up to the top, we sort of came down a bit, but then it was a very slow descent down the other side. And I think we're probably going to be in this for a bit as we come down, as people get back into adhering to the public health measures. And as I said, the concern is that with not only the number of outbreaks that Dr. Huyer was alluding to, but also you notice in these zones, the 4, and Dr. Huyer was alluding to that, you see much more cases of people showing up into long-term care homes with outbreaks being declared. In those settings, more students showing up in school positive, which means there's a lot more community transmission. And people have to be really vigilant in watching their contacts in the next 2 to 3 weeks. If we could do that conservatively, especially in those hot zones, but outside that too, we could drive the numbers down. And it's really in the hands, I guess, and it's more with the masking and the care and the behavior of the public that we can drive that down. And we're trying to say, within the fall weather now, where people are planning how they're going to do things differently in the new normal in the fall, how might or could we do that to get ready for other special events coming up, especially the Christmas season coming, and people are trying to anticipate that. But we're going to have to really work at this stridently over the next 2 to 3 weeks as we try to bring those numbers. And like yourself, I'd like to see those back down well below 700, if not below 500 in a couple of weeks. But it's going to be everybody doing what they should do and do it again and do it consistently.
And Rob, I think you've illustrated a key challenge for everybody, and including all of the experts, which is one number today. And it's really it's alarming when you see the number. It's distressing when you see the number, and you think of the people who are unwell. You think about those who are potentially at risk of being unwell, and everybody wants to focus on that, and understandably, and we do as well. But it's really, what is the trend, what is the pattern, and what do we see over a number of days? But it's very difficult to continue to not focus on a single number. But thanks for bringing that up.
Follow-up?
Yes, thank you. I understand what you're saying on the trends, the more important thing than every single day. Do you think at this point, Dr. Williams, that anything more needs to be done, or are you comfortable just keeping it in modified stage 2 and continuing to hammer home with people that they need to be mindful of the precautions?
So, yes, I can see. I mean, what we're seeing with our data, and Dr. Huyer's alluded to this, is that you're seeing these community and these group and social gathering, clustering, that it's occurring. So obviously people are not yet adhering. And we want to be able to assist those people, are either they don't have the message clear, some may be in situations where it may be impossible to isolate. Well, can we assist you in that? The local public health departments. I know Toronto Public Health is trying to work at how do they look at some more of their populations that may be having some struggles and issues in this regard. We want to help you do everything you need to do, that you can do what you need to do to drive these numbers down. Because in the end, that's what it is. It's very biological, very much distance and spacing, and how you handle those things. And the measures have proven effective in the first wave, and we can bring it back down again. I think to layer on more and more, first we got to do what we've asked to do. And one of the things about the public health measures table is they understand the need in this phase that while you do some limitations on activities, you're very sensitive to the economic impacts of those, because it's one of our determinants of health. And this is important. So you're trying to do a fine balance here, and we want the public to engage in that fine balance. By you doing what you're doing, you're not only helping yourself, but you're protecting others and getting those numbers down so that hopefully very soon we can lift those modified stage 2s back off again. That's the plan. That's the game plan. And so it's not only what you do just for yourself, and you can't be self-centered about this, but it's what you're doing to keep the schools open, to keep the long-term care homes from being impacted, to get the numbers back down, to get out of modified stage 2 and get all those things back open again, because there's a number of people's livelihoods are involved with here. And so we see the comprehensive wide picture, but everybody has to see it beyond just your own perspective. You have to look at how you're part in the overall delivery of it, especially if you're in those hot zones, because together we can do it, and I think we have done it. We can do it again.
This is really hard. It's really hard for people to do this day in, day out, and I think everybody recognizes how hard it is for each individual and groups and families and those who are working every day for many hours to earn a living, and it is very hard to be able to do this all the time, and so everybody working together and thinking about this and thinking about the situation that they're going into, the potential risk that they may be facing, the potential risk they may bring to others. I think that's the important thing. People are going to do things that they need to do in their lives. They're going to do their essential activities. They're going to do their work activities. It's thinking about each of those and thinking about the potential situation that they may be entering into and the potential that they could get infected, but also the potential they could infect others. So it's really maintaining that thought, maintaining the precautions, and in a way that is as least intrusive to everybody as possible, but it will be intrusive. There's no question about that, and we recognize how hard it is.
Next question, and this is the last question.
Your final question comes from Colin DeMillo with CTV News. Please go ahead.
Hello, doctors. I just wanted to pick up on that. How worried are you, or how concerned are you that the measures you've taken so far, and not just the measures taken 2 weeks ago, nearly 2 weeks ago, but the measures taken all the way since the middle of September, don't seem to be having the impact that we were all hoping? I mean, we're 2 weeks out, or nearly 2 weeks out from closing down bars and restaurants and gyms and for indoor dining and gyms and all of that. Yet we're not really seeing the numbers come down. Is that ultimately not concerning to you? And then what does it say about whether or not these were the right measures to take, because they don't really seem to be having the impact?
So there's a mixed message there, and thank you for asking the question, Colin, because as you know, when we had those back, before we put those measures in, we had our technical briefing with Dr. Brown, and the modelers looked at where we were tracking at that time, and it did not look very good. We were on a very exponential rise, as he said, the upper end of the hockey stick, and saying if we did not put some things in place, he would predict that in the 10 to 12 days after that, which is before this time, we would have already doubled our numbers from then about the 900 level up to easy over 1,000 a day to 1,200 a day. So I think I take some aspect that we have carried out some measures. We have bent that a bit. Is it as much as I'd like to have it to see yet? No. We've just passed the 10 or 12 day period, so we're still going through that. At the same time, as I said, we're interposing that with the long weekend on Thanksgiving, when there was a lot of people gathering, and as we've alluded to, and Dr. Huyer's alluded to, we saw a lot of we're seeing a lot of breaks related to family and social gatherings that have been occurring, especially in the areas that are under the modified stage 2. So I think we still need to see those two separated and see the ongoing impact. We've seen some good progression in Ottawa, but it's only just a short look. I'd like to be encouraged by that, but we still have to see how it goes in the long run. And so we have a number of days to go. That's why we said we want to do it for 28 days, knowing that we would doubt we would not see a full impact or much impact in the first 14, just because of the time delays, as Dr. Huyer alluded to, when the testing takes place, exposure, and the positivity aspects there. So I'd like to see it better, and I'm glad we're not where we thought the modelers said we would be. But I'd like to watch for a while and see if we can bring it back down again. So you can see on some of our curves we're tipping over the top, but we got to come down the slope now.
And one of the challenges of prevention is if we've prevented it, we're not going to count it. And so let's hope that we've prevented a lot of transmission by the efforts that have been made, and that may be why our numbers have not continued to increase dramatically. But it is the trend over time, and it is early since the measures were put in place, as I think I understand from Dr. Williams.
Follow-up, and this is the last question.
Thank you. And I just wanted to ask about those rapid testing kits that we're getting, 100,000 of them. I'm wondering if you know whether we're getting 100,000 kits or 100,000 swabs. And would it make more sense from your perspective to send these kits rather than, the north or the rural areas to places like, some of those parts of northwestern Toronto, which is seeing high positivity rates and clearly doesn't have enough testing? Would it make more sense to target it there rather than regions that may not have as much prevalence of COVID-19?
So thanks for that, Colin. They're not specifically involved in all of the testing initiatives at this point. I am aware that there's specific approaches by the Ontario Health and the region specifically and the Toronto Public Health looking at testing and other approaches to Northwest Toronto. Beyond just testing, other aspects of ensuring that the best possible health interventions and education and support are being provided. And in addition, there is plans that are being put in place for the rapid testing, the rapid access testing, both the one that is called One ID, and then there's also a PanBio. One is a PCR test, and that's a test that will turn around and give a result within 15 minutes. And then another one, which is an antigen test, which is still coming. Implementation plans are in place, and I think there's a further information that's coming about that in the near future. But looking at this is not a significant increase in capacity. This will add capacity, but this is to add rapidity, so rapid access testing, using the terminology, and that way this will add a more rapid turnaround in a very quick situation. So in places where it may be challenging from a logistics point of view, or may be important to have immediate understanding of a particular positivity, is where I understand the tests are being incorporated into the testing plan.
Thanks, everyone.
Thank you.